Is there hope and options if you have grade 3 chondromalacia patella of the knee? Hello, this is Dr. Siddharth Dambar, expert in rheumatology and regenerative medicine, physician at Chicago Arthritis and Regenerative Medicine. Question posed to me on one of our social sites recently was an individual who has grade 3 chondromalacia of the patella, and they're asking, is there still hope for them? Let's break this down. Number one, what is chondromalacia patella? Chondromalacia patella is another way of basically saying that there is stress and breakdown of the cartilage underneath the patella or the kneecap. Fairly common cause for arthritis and pain in the knee. Typically when it happens, it's because you've had some degree of chronic instability around the kneecap, leading to stress underneath the kneecap, then leading to breakdown of the cartilage. That's chondromalacia patella. So what do we mean by grade 3? So osteoarthritis or wear and tear arthritis is graded from a 0 to 4 scale, 4 being the most severe, so 3 meaning moderate to advanced. So grade 3 chondromalacia patella means that this individual has moderate to advanced osteoarthritis of the patellofemoral joint. So is there hope for this individual? And presumably when they say, is there hope, they mean, is there an option for treatment besides just knee replacement surgery? So number one, if you talk to reputable orthopedic surgeons, they will generally tell patients for knee arthritis, maximize all your conservative options before you consider surgery. When you're ready for surgery, let us know. That's the right way to think about this, because there's a ton of conservative options that a person with grade 3 chondromalacia of the knee can consider. Moderate to advanced arthritis of the knee should consider. So first off, our knees are incredible. They are evolutionarily made to handle an incredible amount of stress. So the knee is an amazing joint because even if you have a significant degree of arthritis, most people will still retain most of their range of motion. In some people, it may be restricted, and a lot of times that's because there may be some chronic inflammation and swelling in the joint. But it is surprising that in someone that has a lot of arthritis in the knee joint on their X-ray or MRI, that they still maintain a pretty good range of motion and articulating surface of the joint. So knees are interesting. They're special in that they're very hardy and that they're able to take on a ton of stress. And because of that, they tend to respond pretty well to a lot of non-surgical options. So with any knee arthritis patient, first and foremost, have you optimized some conservative treatments. That includes leg strengthening exercises, over-the-counter joint supplements like omega-3, curcumin, glucosamine that can help with pain relief. Have you also optimized an anti-inflammatory diet? Have you optimized your weight as well? For every extra pound of weight that you have on your body, that adds an extra 4 pounds of stress onto the knee. If you can optimize your weight, you can not only result in less stress on the knees, you can actually also improve your metabolic health, which can then help to reduce inflammation in the joints as well. So have you done some of those things? That should always be your first line option for knee osteoarthritis, and that can still be very helpful in someone that has more advanced arthritis. If that's not enough, I generally will then recommend to patients, let's talk about your orthobiologic treatment options or regenerative medicine treatment options. Anywhere from prolotherapy for mild to moderate conditions, arthritis, to platelet-rich plasma, where it's more moderate level arthritis, to your own bone marrow stem cells for moderate to advanced arthritis. What's amazing is that even in someone that has moderate to advanced osteoarthritis, platelet-rich plasma and bone marrow derived stem cells can still give you 65 to 70% improvement in pain for a good decent amount of time. For something like platelets, that relief can be for anywhere from 1 to 3 years. Using your own bone marrow cells, that can be anywhere from 2 to 5 years. So in this individual who has grade 3 chondromalacia patella of the knee, yes, there is still hope. Yes, there is still some very good options non-surgically to help with your pain, to help you reduce inflammation, improve stability, resulting in reduced pain and improved function and overall improving your quality of life. Hope that's helpful. Let us know if you have any other questions. Let us know if you have any other issues that we can help out with. You can always read more, learn more at chicagoarthritis.com or any of our social sites. And until we connect again, have a good day and live well. Bye-bye.